Action. All right, so today we're going to learn how to use our King Vision. It's a little bit different than your traditional laryngoscope blade. There are multiple different types of blades that come with this device. We're going to use the blade that has the guide. This is probably the most universal and easy blade to use. You can use it with a bougie, or you can use it with your ET tube. When you are using the ET tube preloaded in the guide of the King Vision, you don't need a stylet. It'll actually make it harder for you to intubate with the stylet because you don't want it to be rigid since you have this guide. So right here we got firefighter Flint. He's pre-oxygenating the patient. We have an OPA inserted. So once our equipment's checked, the patient's pre-oxygenated, we're going to go ahead and intubate our patient just like we normally would. So we'll turn this on. Make sure the camera comes on. Sometimes the camera has issues. If you have a problem, turn it off, turn it back on, make sure it's on correctly. That green light indicates that the battery is charged. If you have a red light, your battery is dead. You should have spare batteries in your King Vision that you can replace. We'll go ahead and blow up our cuff on our tube. This is a 6.5 tube we're using for our mannequin. So it looks like our cuff inflates, holds air. We'll go ahead and deflate our cuff. And we're going to take it, we're going to go ahead and load this in the guide here. Notice the camera is going to be on the ends of the blade. So you want to put that in the end of the guide, and you want to make sure it's not quite towards the ends, but you want to kind of bend it and get it as close to the blade as you possibly can. Now Flint's going to go ahead and remove the BVM and remove the OPA. He's going to take the mask off the BVM, and we're going to go ahead and insert our device. So we're going to go around the patient's tongue, and you want to go in the vallecula. If you go underneath, or correction, if you go underneath the epiglottis, I'll show you, you're going to be too low. You're going to be going in the patient's esophagus, and it's going to be really hard to get that into your trachea. So you want to go underneath the leaf-like structure. And sometimes you got to give this a little bit of a turn as you're inserting it. And that'll put you right in the perfect spot where you want to intubate your patient. So you're going to visualize it passing through the cords. Go ahead and inflate your cuff. Disattach your syringe. What I like to do, go ahead and attach the bag. Flint's going to go ahead and breathe. We're going to have end tidal on the end of that tube. I like to secure this kind of with my hands right here. So we're going to have someone confirming our tube with negative epigastric sounds, positive sounds on both sides of the chest there. And I like to leave my camera in here because if you need to suction, usually you'll lead with suction. I forgot to do that again because we're using a mannequin, and obviously if you need to suction, you can suction and you can use your camera. It's good to lead with the suction when you're using this because you don't want to get any vomit or any emesis on the end of your camera. If you need to place an OG tube, what I like to do is kind of move this tube over to the side, hold it in place with my hand so you don't dislodge it, pull your blade back a little bit, and then just kind of place it in the esophagus. You have a good visual of the esophagus right there. You'll go ahead and grab your OG tube. Now this isn't going to insert all the way just because it's a mannequin and it doesn't go as far as a normal person would, but you can use that same guide to put your OG tube in. Sometimes you got to manipulate it and you want to make sure that tube is out of the way. Now that it's out of the way, you can visualize it going down the patient's esophagus. Make sure it doesn't coil up. You can see it if you're doing it wrong, it'll start to coil in the back of the patient's throat. You don't want that, but this helps to give a good visual of inserting your OG tube as well. Now you can take your King Vision out, turn it off so you save the battery, and then go ahead and place your tubes inside of your tamer here. Put the bite stick in the patient's mouth. Secure your tubes. And secure your device